My name is Jack Simpson. I'm a lecturer in adult nursing at the University of the West of Scotland. We use LT in the adult nursing programme, the BSc Adult Nursing programme we run here, especially in the third year, the final year. What we had previously is we just made up scenarios based on our own kind of clinical experience. However, with LT, we obviously don't need to do that. We have patients within the software.
And we've chosen 4 patients that they're going to use for the whole 3 years at various stages of their illness, and then we introduce a new patient every year. These are real patients. They are patients, the results from the patients, investigations from the patients are all genuine. So we don't have to make them up.
You're interested because you want to see that person's journey from the start to the finish, what treatment they're receiving, and that helps when you go into the wards, because a sick patient's coming into the ward, you're seeing that patient from the start. You're able to understand what treatment they're receiving and why they're receiving it.
So they start to see a wider picture of that patient, and again they like the idea that they can follow the patient through a longer period of time and not just look at a single day or a single outpatient appointment snapshot, as it were.
It really does prepare you for when you're getting into practice placement, because the scenarios that they're giving you are scenarios that you can come across in the ward.
In any nursing, there's a theory practice gap, and we found LTs bridge that in the fact that we can show them real patients, get the theory, and then when they go to practice, they're actually already loaded with the information they need. So when they see a similar patient with COPD, MI, they're already preloaded with a database of knowledge. If they make mistakes in LT, there's no impact on a patient. But it still gives them that bridge between learning clinical skills and starting to put those skills, synthesise those skills together in a holistic way to deal with a patient, and then transfer that into a practice environment.
I've had situations in practice placement that I don't think I would have felt as confident with if I hadn't used LT and the simulation. There's an example of the cardiac arrest that I was involved in, and through the learning from LT and with the lectures here using the simulation, it helped prepare me for that, so I wasn't as nervous and I knew the steps that I had to take for that. I
can appreciate the value of the platform for our students, and I appreciate the depth of information and data that they can actually, and interaction they can have with LT. So the value in LT to me is in that.